Hello,
Hello.
my name is Maïté Van Den Bossche, and today I'd like to talk to you about behavioral difficulties amongst children. I'm sorry I couldn't make it to you in person, but nevertheless, I'd like to thank Linda for giving me the opportunity to talk to you about this topic. First, I'd like to introduce myself. After that, I'm gonna tell you about a few frequent causes that can cause difficult behavior, what you can do about it, and how you can handle in certain situations. I also gonna tell you something about self-care, and I'm gonna end the presentation by answering some questions you've already sent in. First, I'd like to introduce myself a little bit to you. My name is Maïté Van Den Bossche, and I am a mother of four. I am also a mother of some special needs children. In our family are diagnoses such as autism spectrum disorder, ADHD, and dyspraxia, etc. And I'm also the founder of Atlas. And Atlas is a group practice that's specialized in ASD, ADHD, and high sensitive persons. And with Atlas, I wanted to create a place where there was more humanity in our group practice with psychologists and coaches. For example, by making the waiting lists a bit shorter and by treating people like people and not like numbers or so. I also wanted to create a practice that works from heart to heart. We see a person first, and a diagnosis can come at second place. We also work very much in a systemic way, which means that we are focusing on relationships and not only on the individual persons. For example, when we have a children that we're coaching, when we have a child that we're coaching, we will always involve the entire family, such as brothers, sisters, and of course, parents, rather than focusing on the individual child alone. This quote is a very important quote, I guess. And it goes like this. The kids who need the most love will ask for it in the most unloving of ways. I'd like you to keep this quote in mind during the entire presentation because it's such a great quote and it contains so much truth. And that's the reason why I wanted to start with causes, because many people will come over to me and will explain some behavioral issues they're experiencing with their children, and they ask me how to cope with that. And that's a very difficult question because I always try to find the cause, what's causing this behavior. If we wouldn't do that, we would just be treating symptoms, and we wouldn't be, dig any deeper. I think it's more effective if we search for causes. And I think it also helps us to find preventive ways to cope with difficult behavior. And yeah, preventing is always better than treating. Huh? Although these causes sometimes can be quite difficult to find, that's true. And a diagnosis sometimes can be very helpful to get the cause, to get, to lay our finger on the spot, we say in Dutch, to see where we can find a good cause. Now, frequent causes that we can see when we see children behaving in a very aggressive or difficult or even annoying way. A lot of this behavior has to do with gaining control. These are the self-determined children who, for example, want to decide who needs to sit where in the car, who needs to sit where at the table, who can be very commanding and very bossy sometimes as well. It's very important to know that these children have a huge anxiety to lose control because often um, they feel very unpredictable. They feel very chaotic in this world. They can feel very they experience a lot of fear, um, which has a lot of, yeah, often it has a lot to do with the way of how they process information that comes in. And that can feel very, very overwhelming and very unpredictable, and by that also very unsafe. Another cause that is very, very important to know is that some children function in a very much, much younger socially emotional age than they biologically are. So, for example, if you have a child that is, let's say, 7 years old, it is possible that he or she is only functioning socially emotional in, let's say, an age of 1 year and a half. And that's something we see a lot amongst children who suffer from ASD, ADD, ADHD, for example. Um, and when you look at all the phases of the development in the socially emotional development, you see sometimes in this young stage, you find this fear of abandonment, for example. And this is a fear that's very, very real and can be a very difficult struggle for parents as well. But at this phase, in this stage of development, children aren't able to self-regulate emotions yet. They need someone with them to do so. And when we see this behavior with children younger than 2 years old, we say, okay, that's completely normal. When we see these behaviors occurring with children who are older, let's say 7 years old, then we find that a little bit atypical. The same goes with children who are 2 years old and who are having tantrums. We say, oh, that's completely normal because it's just part of the age. But when you're having children of 7 years, 9 years, maybe even 16 years old, who are still having these tantrums, we say, atypical. But yet, it is quite possible that these children are functioning in this very, very young socially emotional age. So that's very important for you to know, because then you see the difference between a child who is unwilling to do certain things or unable to do them. And that's a huge difference, of course. Object permanence is also something like that. With very young children, with toddlers, we see how they have very much difficulty, experience very much difficulties when their parents are leaving the room, because when objects or persons are out of sight, it literally means that they're gone. They cannot see them, they cannot hear them. So for them, it means they don't exist anymore. And even this can be, yeah, with your child who is perhaps even 14 years old, but in this socially emotional phase where he's still experiencing that. So that's a very, very important thing to know when we are looking at causes of difficult behavior. Sensory processing problems, also something we see a lot. Problems with taste, hearing, sight, smell, touch, movement, balance, and so on. There are many more senses than most people know about. And they can lead to problems such as eating problems, eating disorders, problems when they are in a crowded place, when children have difficulties with cutting their nails or taking a shower, washing their hair, brushing their teeth can be very, very challenging for children who are experiencing sensory processing problems. And one way, yeah, it can go a little bit different, is when senses come in, sensory stimuli come in very, very intense. And we speak about overstimulation. And when people or children are understimulated, sensory stimuli come in too little. For example, someone touches your shoulder, but you wouldn't even notice it because the touch of that don't come in that good to notice it. A very good tool to help you with that is a sensory profile. A sensory profile is something you can make up with a psychologist, or you can let be tested with an autism coach or a sensory coach. And a sensory profile is a list of all the difficulties your child is experiencing in its sensory development. And of course, it can also provide a list of solutions and tips on how to cope with these difficulties. So this sensory profile can actually be a great tool. Another cause can be, impulsive behavior, not being able to control certain impulses. We see these behaviors amongst children with ADD, ADHD, OCD, La Tourette. Um, these children simply aren't able to control the feelings they're experiencing and just bursts out. Uh, they're not able to control their impulses. Another cause of difficult behavior or even aggressive behavior, child that can be very nagging, annoying, a little bit not knowing what to do, a little bit, nagging, can often uh, um, be there because of the need of predictability. Yeah. Um, the predictability or a structure or a child that knows what comes then and what comes next and what they're gonna do has everything very predictable, and that makes the world a little less chaotic for them. It'll lower the anxiety they're experiencing, and they know what comes next, and that makes them feel very safe. So this need for predictability can be a very important cause of difficult behavior as well. Uh, cause that you're probably familiar with is the cause of feeling bored. A child that doesn't know what to do or doesn't know how to do it, doesn't know with who to do it, when to do it, why to do it, um, where it needs to be done, in what time frame it needs to be done, can feel very, very bored. And that bored feeling can often lead to very annoying behavior, hurting other people, hurting their sisters or their brothers or other siblings. Can be very annoying behavior. So these are a few causes. Of course, the list is way longer than that, of course. Um, but these were a few very important ones. Of course, now is the question, what can you do about it? How can you respond to this difficult behavior? Well, for example, a very important one is sometimes to lower the expectations, especially when I talked about these children who are functioning in a much younger socially emotional phase. Um, it is very important that we lower down our expectations. We can't expect a 7-year-old, which is functioning socially emotional at the age of, let's say, 9 months old. We can't expect them to fall asleep alone or to go for a walk by their own. That's difficult because we would expect a 7-year-old to play around in the garden by itself, for example. But when this child is functioning in this way, way, way younger socially emotional age, it might not be such a good idea to expect this from that child because it simply isn't able yet to do that by himself. Um, an important tip as well is to make it as comfortable for you as you can. Being a parent of a special need child, especially when your special need child is functioning socially, emotionally much younger, um, you need to see how you can take care of yourself. For example, if you have a child that isn't able to fall asleep by itself, and you have to spend the night sitting by their bed until they fall asleep, for example, it's okay to do so. If your child isn't able to do so, you don't have any other options, but make it as comfortable for yourself as possible. For example, by taking an extra pillow for yourself, reading an extra good book, take a cup of tea with you when you're sitting by the bed, next to the bed. These are tips that make your life a little bit more comfortable. As I told you before, these sensory profiles can help you to list up the difficulties in sensory processing. And can also give you a few tips and tricks on how to handle certain situations. These can be tested by a psychologist, autism coach, or a coach with sensory processing disorders, and so on. When you have a child that has a very great need of predictability, you can start using daily schedules to help your child predict what comes next. Best way to do that is in a very visual way by using icons, photos, drawings, whatever can help you to make it very clear for your child what the steps of the day can be. Sometimes it's not necessary to work so visual. Sometimes you can talk them. You can talk through the day as well. Some children don't need visual ways, but yeah, make very clear what expectations you have about the day and what the planning will be for the day that's coming on. Time in versus time out. Well, a time out can certainly be a great tool for children who are very overstimulated and can help them to calm them down. When you're giving a child a time out, you are putting them away. That sounds a bit rushed, but um, you're putting them away from you so they can calm down by themselves. Now, of course, when you have a child who is functioning in this much younger socially emotional phase, it won't be so appropriate because they can't self-regulate yet. They need your help, so they need you to stick nearby. And then a time in is a much more useful tool than a time out. A time in means you get to stay with your child as close as possible. Some children will be needing a hug. Some children won't even have you nearby, so you'll have to keep your distance a little bit more. Um, but in this way, you stay nearby and you help your child to regulate their feelings, and that's what they call co-regulation. It's not self-regulation, you're helping the child, so it's a co-regulation. And that's where a time in can be a great tool. Another advantage of a time in is that when you give a time out, it's like you're saying, I don't want this behavior. I don't want this feeling. I keep it locked out. I don't want you nearby me now. When you're giving your child a time in, you're actually allowing your child to experience these behaviors. Of course, you can tell them it's not okay to do this and that, and you can put boundaries on the behavior, of course, but the emotion is completely allowed. You can tell them how much they are suffering at that time. You see the struggle they're dealing with. So a time in is a much softer way, a much more connecting way than a time out. Very important also is that when your child is behaving in a way that you really just could run away, to stay very calm and very neutral. I know this tip is sometimes easierly said than done. And it's okay if sometimes it doesn't, yeah, you're just not able to do it. But whenever you can, try to stay as calm and neutral as possible. Remain your voice in a firm and neutral way. Also, your body language, don't get too overwhelmed, don't get too stressed out. Keep everything calm, try to breathe, and de-escalate by remaining calm and neutral. When you are starting to get stressed out and you're really starting to move a little bit more and your voice gets higher, your voice gets louder, it won't help your child to de-escalate. And that's actually what you'd like to do at that time. You'd like to de-escalate the situation so the behavior won't be causing too much of a damage. Um, when you have children who are very impulsive, remember the cause of the impulsive, the difficulties of controlling the impulses. Um, you can set up reminders for them. For example, use a little bracelet that you put on their hand and use them as a reminder for special rules. For example, when your child is always can get very angry, and when he gets angry, he or she can start pulling hair of other children. Make sure that you put on a bracelet and then you say, you know, this, you know the rule that we put up? We said you're not allowed to pull other person's hair. This bracelet will actually help you to remind this rule. So, yeah, there will be a chance that the child, whenever he gets the impulse and he feels the angriness, that he will notice the bracelet, and hopefully he will remember. Here comes a rule. I have to stay calm. Stay calm. No, no, it's not. Um, we can't ask of a child that's so impulsive to stay calm, but at least he can remember. There was a rule. I'm not allowed to pull anyone's hair. Huh? And clear consequences are very important as well. That you say, whenever you do so, yeah, there will be a consequence. For example, you will come over to me and you will sit on that chair during 2 minutes, for example. Every time he breaks the rule, you put up the same consequence and you stick through. So every time he breaks a rule, you make sure that the consequence you've told him, that you're following up, that you're doing so, that you're doing that in a very consequent way. There were people who asked me if it was possible to, for example, have these impulsive behavior, if there was a medical treatment for it. The answer is yes, there is, but first place, it's not up to me to tell you about that. It's you have to go to a child psychiatrist for that. Um, and secondly, I think it's very important that you always see medical treatment as a very last option, so that you use other things first. Um, but if it is necessary, it can be a very great, helpful tool. But you need to handle it with care. Okay, very important also. What can you do? Lower down the stress. Make stress, or better said, the lowering down of the stress, a priority in your family. Um, try to look at your situation, try to run through your day, look at all the routines that you have, the morning, the noon, the evening. Are there certain situations where you can lower down the stress? What can you do? Take a very critical look at that. Are there certain things you can do to lower down the stress? For example, by picking your battles, by saying, okay, maybe the next few weeks I'm gonna focus on this new rule, but all the other rules I'm gonna let go a little bit. I'm gonna be less focused on that. Pick your battles. Difficult behavior is often a sign of stress. So the less stress you put in your family, the less likely your child will develop aggressive or difficult behavior. And realize that difficult behavior is also very difficult for your child. It's not something they do to terrorize you or to frustrate you or to make that they're not doing it to make your life miserable, although it can feel like that sometimes, of course. But realize that these difficult situations are difficult for your child as well. um, and then I also would like to teach you the big five that create a lot of predictability. In every situation, you can ask, and especially situations where you see that your child is behaving in a very aggressively way, ask yourself the following five questions. One, does my child know what he or she needs to do right now? What I expect of him or her? Secondly, how does it need to be done? So when I'm expecting, for example, a task, do they know how, in what way they need to perform the task? Where is the place that this task needs to be done? When, in what time frame does it need to be done? And with who? Is this something they need to do by themselves, or is this something they can get help with? And if so, with who? Okay, children who are easily overstimulated. Um, if you are in a situation where a child gets really overstimulated, for example, a family party, um, you can ask yourself the question if it is possible to get out of that situation. Is it possible to leave? Okay, then do so. If it's not, and sometimes it is so, for example, when you're on a concert or something, it's not just possible to run out of it. Then you can ask yourself the questions, are there any tools that can help? For example, at a concert, these noise canceling earphones can help for your child. Thirdly, sometimes it's not such a good idea to avoid all stressful situations, but it can be helpful to reduce the time of exposure. For example, when you go to the family party, you don't have to say that you're not able to come. You can come over, but maybe you can reduce the time. So maybe you can, for example, instead of coming 3 hours, you just can come over for 1 hour. And make sure that there's plenty of time during the day to give your child the chance to wind down, to give your child a little bit more of rest, a rest time. Um, when your child is understimulated, it needs more activities or tools that offer more stimuli. This can come in several tools, for example, by swinging on a swing, jumping on the trampoline, singing in the microphone and making noises like that, um, chewing gum when they are having needs of extra touch in their mouth. Children who are often biting on their nails or biting on their clothes can be very chewing gum can be a very helpful tool for those children. And also, even with these children, make sure there's plenty of wind down time during the day, that even those children who need more stimuli also get these resting times from time to time, so they won't get overstimulated. Okay, I also want to tell you a little bit more about self-care because I find this so very important. We, as parents of special needs children, often think we need to know everything about our children. We need to know how to react, how to respond in certain situations. We need to know how they work, how they react, yeah, how they are. But we often forget to take care of ourselves, and that's pretty much a base because a parent that's very in control and in balance with himself or herself can very much more easily provide the patientness or the kindness or the um, I can't come up to the word right now. It can be a very better parent, basically. The better you take care of yourself, the better it will go to be a good parent. So ask yourself the question, what is it that you need to get through your day? Your sometimes very difficult day, I can imagine. And try to find some structure in your self-care, not by planning weekly by weekly, oh, when am I gonna take care of myself? When am I gonna plan a little moment for myself? Try to make it a more structured something. To get yourself a routine. Find something you can do on a daily basis. For example, every time after lunch, you take a break and you do a short breathing exercise, for example. Or every day after dinner, you take the dog and you go for a little walk. And then you ask yourself, okay, what can I do on a weekly basis? Can I, for example, say, okay, let's say Friday night is mom's girls out night and I'm taking my girlfriends and I'm going out for a drink or something, or I just gonna have a nice warm bath and drink a nice cup of tea, also possible. And is there also something you can do on a monthly basis? And try to make this a very, very structured something that you do every day, every week, and every month. And also remember, you're not doing this for yourself, you're doing it for your children. So try to find out what helps you to relax, what helps you to charge your own battery. It can be very, very small things, such as singing whilst driving your child to school in your car, listening to a podcast or some music with your headphones while you're making dinner, a breathing exercise, counting to 10 and back again, going to the toilet on your own, although even that can be quite a challenge sometimes. Work a little less, change your job. Of course, these are the big tasks, but even that, try to be very critical and reflect on your life. What can I do to help myself being a better, more patient parent? And this can also be helped by expanding your network. When you have a lot of people around you to talk to complain about to sometimes, or to help you with the kids, to take care of the kids, to help you in the household. See if there's any possibility to expand your network. So even that can help you as well. And stay as stress-free as possible. I know it's easier said than done, but yeah, it's a good excuse to book that extra day to the spa. Huh? And don't be afraid to take what you need. We are often so focused on our children that we really forget to take care of ourselves. And that's, yeah, a bit, that's very I say that's a pity, because the better you take care of yourself, the better you are able to take care of your child. So if you want to take the best care of your child as possible, take good care of yourself. That's the base. It all starts with that. Um, some tips to help you as well is to plan in on the daily schedule of your child. Even there, the moments of rest you have, the mommy times or the daddy times, you can plan in the schedule of your child as well. Um, or you can take a chair in your living room and you say, okay, this from now on, this is our quiet chair. Whenever you are on that chair, no one is allowed to talk to you, and you aren't allowed to talk as well. But the same goes for mommy and daddy. When mommy or daddy on that chair are sitting on that chair, they are not gonna talk. They are just gonna be, they want some quiet time. Can't ask them questions. I'm not gonna respond to the questions. At first, it will be a bit tricky and a bit difficult to set up some boundaries about these one. But once the children are familiar with it, it can work very well. Set up a few boxes of toys, especially for the mommy or daddy time. For example, when mommy wants to go in a bath, you take out the box of special toys and the children are, yay! Because, yeah, it's a very special box. They don't have the chance to play with it all the time. So make it very predictable for your children as well whenever you feel the need of self-care time. Okay, I've received an email with a few questions of you earlier, and I've tried to take some of these questions, and I'm trying to answering these a little bit. I need to tell you it was quite difficult for me to respond, because for me it's very important to know the cause, and sometimes you can find the cause when you're just reading a few sentences. Sometimes you need to see the entire situation or context. And so it wasn't very easy, but let's give it a try. Okay, this question was asked from a mother, and the situation is always during the meals that the daughter often has to decide where everyone sits at the table. She shall decide who has to do with this or that. And the same happens when they are driving a car. She must have full control on who shall drive and where everybody shall sit. The same behavior happens also in conjunction with daily routines like brushing hair, spreading cream, clothing, and similar activities. Now, the clothing issue has, yeah, probably something to do with the sensory issues, can have something to do with the way they experience touch on their skin. But you also can tell that this girl is gaining control, is trying to gain control. And she's feeling very anxious in a chaotic world, and it's her way to try to make it less chaotic. She's trying to gain this control about the things that she can control, because there's so much around her that she cannot control. But at least she's trying to control those things that she can. So try to make things more predictable during the day. Try to make her day a little less chaotic. And we often see increasing controlling and demanding behavior when children feel more anxious and stressed out. So try to keep the stress level a little bit more down, and yeah, make it a little bit more predictable for them. The next question. S is a very smart, wise, and observant girl, but also boundless and cunning. She can, out of the blue, very quickly destroy and smash things around. Yeah. And sometimes when she doesn't get her will, she threatens with vomiting. Either just starting gurgling or put her fingers in her throat. And mostly we can't stop her from vomiting. How to deal with all this? Now, also, this is something to do with gaining control, with having to say, I want to control this. I'm gonna tell you how it works. I'm gonna tell you, it's her way to make it a little bit more, okay, a little less chaotic in her head. She's trying to gain control. So also the same thing I told before is try to make things more predictable during the day and stay very calm and neutral as soon as she's trying to vomit. I know that can be a very, very difficult one because your first reaction probably will be, no, stop, don't do that, or what are you doing? Try to stay as calm and neutral as possible. But also let her know that you see her struggle. So instead of saying, no, you cannot do that and stop doing that, you can say things like, I can see that you're really upset right now. Um, I can see that you're dealing with struggles and you're having a really difficult time. I feel sorry for you right now. It's a very different response than when we would say immediately, stop, don't do that. Um, she will feel a bit more seen when you approach the behavior like that. And try to pronounce the emotions she's dealing with without fearing them. It's okay if you tell her, I see that you're afraid of trying something new. I see that you're feeling very angry. I see that you're struggling with it. Um, that really opens the door to set up a real good conversation instead of fighting each other. Another question. Anytime things don't go the way my child thinks it should go, he melts down. He becomes loud, defiant, and pessimistic. How can I stop this downward spiral caused by disappointment? And another question. He tries to control me, to have me by his side all the time, to control his sister. Always it has to be his way. How do I deal with this behavior? Again, again about children who are trying to gain control, who are feeling very anxious in this chaotic world, and who are trying to control the things that they can control. Um, Try to look at your children through different glasses. They actually are trying to tell you that things aren't going well and that they can feel very overwhelmed with emotions. Let them know, let them feel that you're constantly there for them, even though you may not be nearby. Realize that self-regulation might be a bit too difficult yet, even though that can be quite a challenge for many parents. Take care of yourself, and so you can deal with these situations in a much better way. Some situations can be attached to certain situations. Wait, that wasn't correct. Some behavior can be attached to certain situations. For example, my son is able to wear his sunglasses at home, but at school he refuses to wear them. Now, this is caused by a contextual issues, and we see this behavior a lot amongst children with ASD, with autism spectrum disorders. Um, these people, these children experience contextual issues. They can be quite good at something in one situation, for example, tying their shoes. They can do it perfectly at home. But in the other situation, they suddenly aren't able to do that anymore. So, for example, the shoe can get tied at school, but when the child gets home, he's not able to do so anymore. Sometimes it can be quite difficult to explore what exactly is causing the ability or the disability in one or the other context. Sometimes it has something to do with the people that surround him. Sometimes it can be the environment that's causing the difficulties. For example, a child that came over at our practice had problems with eating bananas at home. But the soon she got at school, there wasn't a problem at all, and she ate all her bananas perfectly fine. So we couldn't find out what was causing that she couldn't do it in the at school in that situation. She could not do it at home in the other situation. And then we started to put the banana in a fruit box at home, and poof, suddenly she started eating bananas at home. So that was clearly a contextual issue. And I think it'll be something like that with the sunglasses as well. But it can be quite difficult to explore where what's actually causing the ability or the disability. Another question. My son is obsessed with doors. He likes to open them or close them. At night, when we try to lock our door, he'll start screaming and shouting. Also, this opening doors and closing doors, that's very predictable. It's his way to find um, to calm down in this world. It can be very stressful for him. The soon he starts to open or close doors, it gives him a safe feeling because it always looks the same. It's very predictable. I do this, the door is closed. Yes, I do that, the door is open. Wow. I see the same behavior with children who put on the lights and put out the lights. They put it on, they put it off. They put it on, they put it off. And so on. It's very predictable. It makes them feel very safe because it's always the same reaction that they get. So again, it's about gaining control. Now, whenever the door gets closed, he also might feel very upset because now things start to get really unpredictable and he's not able to get out anymore as well. Try to make this specific situation a little bit more predictable by, for example, drawing this situation in a simple sketch. So during the day, we leave the door open, you draw, and during the night, you draw a little moon to make sure that your son understands that it means the night. It gets locked, and you draw a key. Um, yeah, okay, that can be a tip as well. I'm not saying that this will work immediately, but yeah, it's at least you can give it a try. Okay, another example that many of you will recognize, I think, is whenever I'm on the phone, my son starts shouting and crying for attention. Okay, here's the cause very clearly the socially emotional young age. It can be quite difficult for your son now, yet, to share your attention. We see this behavior well among very young children as well, who are attached to their caregiver so much they need them nearby every minute of the day. Um, the fear of abandonment is yeah very typical in this phase of the socially emotional development. It might be helpful to perform an emotional social test on him to find out what socially emotional age category your son is in. This might take it easier for you to understand his behavior and to lower down your expectations. Maybe, yeah, it's simply not that simple for your son to share this attention of you, and might be a better idea for you to go out of the room and to talk somewhere else while your husband, for example, stays with your son, than that you can expect him to stay calm while you are on the phone. What you also can try to do is make this situation very clear by setting up rules. Mom on the phone means I get to play with my special phone box. We had a special mommy bath time box as well. Now we have a special phone box also. Yeah? And this you can make very visual by setting up a rule and hanging it on a piece of paper in your house, in the kitchen, for example, where you say, Mom on the phone, and then an arrow. It means that you get to play with your special phone box, with all kinds of toys in it. Yeah, you can try it. It's at least worth the try. Okay, I think, yes, this was the last question, actually. I'd like to finish with the sentence, pick your battles. Um, I'm not expecting, and you shouldn't either, expecting of yourself that you are the best or the most perfect parent. You are a parent of a special needs child. That is quite something. You can give yourself some credit for that. So do the best you can, but don't be too hard on yourself, please. Okay. That was something I wanted to tell you before I ended this presentation. Okay, if you would like to get in touch with me or ask me some more questions, you can always send me an email by maite@atlas.be, or please visit our website www.atlas.be. And if you'd like, you can subscribe to our newsletter also. Okay, I wish you a very lovely day, and I hope this presentation may have inspired you.